Dr. Chin Chan from Australia. Chin is the longest serving board member of ICMART, of all 15 of us who are there. He has been the General Secretary of ICMART for 5 years. He has been the President of ICMART, and he had been Vice President and different other functions within ICMART. In Australia, he is the person who has established medical acupuncture in Australia, propagated it, made it known to the political institutions. And last year I stayed there at a congress, and he got honored because he really dedicated his whole medical life to medical acupuncture. Today he's speaking about staying healthy with medical acupuncture. Dear Chin, the floor is yours. Welcome very much. Chin, we cannot hear you. Please open your microphone.
Do we have sound?
Now it's perfect. Thank you.
Okay. Let's share. There it is. Okay.
Okay.
Is that the correct slide?
Yes.
Okay. Thank you for the introduction. She said my talk will be about staying healthy with medical acupuncture. I am going to introduce you to a lady named Lois. She's 82 years old, and she was referred to me by her osteopath. First came in April of 2024. Now, I'm sure you have all got patients like this: unwell, tired, no energy, depressed, lies in bed most of the day. She won't leave the house, doesn't have the energy. She rates her well-being at 2 out of 10, energy levels out of 2 out of 10. She lives alone, and she lost a husband about 16 years ago. So that is a challenging list of symptoms. Now, the source of her trouble is the leaky tricuspid valve, which was diagnosed a year before she came to see me. A cardiologist made the diagnosis. She's been treated with medication, and she is now in controlled heart failure and should be able to get around. But she has no energy and remains short of breath on exertion. She was assessed by a respiratory physician, and they could not find any lung problems, no respiratory system problems. This is her list of medication. Hypertension medication, fluid medication. She has gastric reflux, and she has a hypoactive thyroid. So it's a large list. When you examine her thoroughly, I found that all her muscles were tender in the head, in the neck, in the upper trapezius muscles, in the buttock, in the paravertebral muscles of the spine, and the iliotibial band. Everywhere you touch was extremely tender. Now, this indicates inflammation, widespread inflammation. So, I commenced treatment with acupuncture, safe in the knowledge that it will not interfere or interact with her medication. I commenced treatment with this treatment, liver 3, spleen 6, stomach 36, and large intestine 4, bilaterally at weekly intervals, April 17, April 24. When she came back after the second treatment, there may have been a slight increase in energy. So at this stage, we added electroacupuncture. We added electroacupuncture at stomach 36 using a low frequency stimulation at 1 Hertz and continued to treat her on a weekly basis. After 7 treatments, she was noticeably better, and then we transitioned to treatment every 2 weeks, and her well-being continued to improve and her energy levels continued to improve, and she was starting to do things for herself. On August the 12th, we added a supplement, coenzyme Q10. She continued to improve, and the biggest improvement came with the addition of electroacupuncture. At the last treatment, these were her ratings. Her well-being was now 8 out of 10, initially 2. Energy at 8 out of 10, initially 2. She's no longer sleeping in the day. She goes out shopping on her own, and she's now able to cook family dinners for the children and grandchildren. And she's even booked to go overseas. So the quality of life is much better. Now, some comments about the treatment. Stomach 36 has been shown in studies to improve gastrointestinal function, which helps with reflux. It is shown to improve and reduce inflammation. It reduces the inflammatory cytokines, the interleukins, tumor necrosis factor, and many others. So it is doing something definitely. It also increases the level of endorphins, which is good for pain, helps healing, and improves the well-being. The mitochondria is the powerhouse of the cell. It produces the energy that powers the cell. It takes in adenosine diphosphate, ADP, and it puts out triphosphate, ATP. And the ATP circulates through the cell, drops a phosphate plus energy, and comes back for recycling. And this is done through the oxidative phosphorylation process in the cristae within the mitochondria. This oxidative phosphorylation process requires coenzyme Q10. So the more Q10 she has available, the more energy she can produce. We also know that in heart failure, the myocardium is deficient in coenzyme Q10. So that also added to her well-being. And a note about statin medication, cholesterol-lowering medication, they also deplete the myocardium of coenzyme Q10. So we have treated Lois in April with acupuncture, nutritional supplements, no change in her medication, and in September she's up and running and booked the trip to go overseas. So in a period of 5 months, she's gone from this to this. Not perfect, but 80% is not a bad outcome for someone with heart failure. Thank you. That's all I have to say.